Hi, I'm here talking with Dr. Kevin Huff, general dentist in Dover, Ohio, and oral facial pain specialist who has a particular love for doing dentures. And there's a lot that goes into dentures. And I have him here today to tell us a little bit about what you need to know about dentures. Thanks for being here, Dr. Huff.
And thank you. Thank you for having me. So, complete dentures sounds like when we say complete dentures, we're thinking, oh, that's old school. Nobody needs complete dentures anymore. Well, I would tell you that that's just not the case. Our population is aging, and many of our patients that wear complete dentures actually lost their teeth in the middle of the last century somewhere. So they're older patients. Um, a common trend today is for people to just say, well, let's just put implants in, screw the denture in, don't have to take it out. The problem is that many of these people either cannot afford the high costs involved with dental implants and maintenance of dental implants, but also anatomically, these patients can't wear or can't have implants placed. So they are stuck. They're stuck with complete dentures. And the sad part is that dental schools are teaching less and less about complete dentures simply because their curriculum has been expanded. So they have to include many other topics as well. But not only that, the demand for dentures is significantly less than it is for implants. So I do have a love for complete dentures, but more importantly, I have a love for the patients who are forced to wear complete dentures, because it's frustrating to me when I see dentures that are made as plates rather than prostheses, or economic clinics that make dentures and they cut corners because they somehow think it's less of a problem. And the thing is that dentures are not replacement for teeth. They are a replacement for no teeth. So, it's very difficult to teach people that want to go to dentures. I mean, we do have patients that insist that they have their teeth taken out and that they go to dentures because grandma wore dentures, grandpa wore dentures, and they never had any problems with it. And I would argue that they did have problems with complete dentures, but they just adapted to it because it was more of the norm. And so we don't ever want to see people choose to go to complete dentures, but when they have to, then they need to be done appropriately. And that's really, that's my passion. In fact, I just finished writing a book about that, sharing that passion. So another thing that patients don't realize is that the average denture should be replaced about every 5 to 7 years.
Wow.
Um, they should be relined about every 2 to 3 years. And what we see is that doesn't happen. Many people have dentures made and then they think they never have to go to the dentist until it's a problem. With 40, 50 years, I've seen dentures as old as 60 years old. Okay.
Wow.
And how they are still functioning, it's amazing, but
Are-
they're not functioning well. Let's put it that way.
So they probably are in pain, right?
Many times they are in pain.
Doesn't stay in.
Well, yes, they are in pain because what happens is as you wear, dentures are made as literally as plates. Okay, we don't like to use that term, but they distribute forces throughout the jawbone. Okay, now the jawbone was designed and created to withstand forces of individual teeth held into the socket by many cables that pull in different directions. And that strengthens the bone. Well, when you lose the teeth, you don't have that bone. So you get what's called atrophy or bone shrinkage that continues throughout life. So, and then if you add to that a poorly fitting prosthesis or a poorly fitting denture, that speeds up the process as well. So what we see is as people age, their appearance with a denture seems to be that the lower jaw seems to come forward, the upper jaw seems to collapse back. So you end up with these kind of Andy Gump type of appearances. If
Mhm.
you've or Andy Gump. And the what happens is actually the dimension between the nose and the chin is reducing. So the muscles are designed to function at a certain length. So as the denture gets compromised, then the joints have to adapt. So we end up with muscle pain, joint pain, many times denture sores, because now the force is distributed down into the soft tissues. So that's why relines are done, to try to accommodate that over time, and also to try to rejuvenate and prolong the denture as long as possible, so that maybe that 5 to 7 years might be pushed out 8 to 10 years, something like that. It really depends. And the last thing that's really important about denture wearers is that it's incredibly important that if you wear dentures, that you get an annual dental exam, because during the dental exam, we look for oral cancer. One of the largest populations that people have oral cancer is in the denture wearing population, because they don't get evaluated on a regular basis.